morning. I'm Dr. Alana.
Hi,
Pleasure
doctor.
to meet you.
Good to meet you.
Who do I have the pleasure with?
My name is Joe.
Joe. Can I get a full name, please?
Joseph Green.
Joseph Green. Is there any specific way you would like me to address you during this consultation?
Just Joe. It's
Joe
fine.
is fine? Okay. How old are you, Joe?
I'm 43.
42.
Just.
Is there anything you would like me to change in this room for you to feel more at ease?
No, this is fine. Thank
Okay.
you.
So I will ask you a few questions for me to understand the reason you came today. And I may do a physical examination, so I will be in close contact with you. Will that be fine?
Absolutely.
Okay, so tell me, how can I help you today?
I developed some heaviness and pain in my chest that started yesterday afternoon. And that was concerning to me, so I decided to come in to see you.
Could you tell me or pinpoint the exact location of this pain?
Sure, it's like on the left side of my chest, right about my nipple, and it will sometimes radiate to my left arm.
Does it radiate to another part or
Just to my arm, nowhere
just to your
else.
arm? Okay. And how would you define the pain from a scale from 0, which is no pain, to 10, which will be the worst pain you have ever felt?
It's not too bad, maybe a 2 or a 3.
Okay, so you mentioned heaviness.
Mhm.
Do you feel another things such as throbbing, constricted pain, or like a stabbing-like pain, or it's just heaviness?
Just a heaviness, no stabbing or burning or any other, kind of a heaviness, maybe a tightness would be a better description.
Okay. And you mentioned that it started.
Yeah. So I was actually shopping for a house, and we were looking at homes yesterday.
Yesterday, shopping for a house. Okay, and this feeling, this chest pain, how long did it last? A few minutes, a few seconds, hours? Was it constant?
It's constant. It started yesterday at about 4 p.m. And I've had it pretty constant up through to today.
Have you taken any medication or something to relieve the pain?
I took a baby aspirin, but that's all.
That's all. And for example, is there any factor or anything that could trigger or worsen the pain?
Not that I've noticed. No.
Okay, so I'm going to move on to know a little bit more about your past medical history.
Okay.
Would that be fine?
Sure.
Okay, do you have any allergies or drug resistance?
I am allergic to morphine, kiwi, and latex.
Okay. Tell me, Joe, have you ever had any surgery or have you ever been hospitalized?
I had surgery probably 20 years ago. I had an appendectomy. That was my last surgery and hospitalization.
In the hospital. Okay. Are you currently taking any medications or supplements?
I take an antidepressant. I take Wellbutrin or bupropion.
Okay. Do you know if you're up to date with your vaccines?
I am, yes.
Okay. Do you remember if you have had any chronic illness or any health issue related problem when you were younger, like chickenpox perhaps?
I actually never had chickenpox, and there were no health issues from my youth that I can recall.
Okay, I would like to ask you now questions about your family. Okay,
Sure.
so tell me, how's the family health?
I overall, well, I don't speak to my father. I've not spoken to my father in over 20 years, so I don't even know what his status is. But my mother is alive and healthy, yes. I have one brother and one sister. They are also alive and healthy.
Can you tell me their ages, please?
My brother is 50 and my sister is 54.
And from mom and dad?
Mom is 71 and dad, if he is still alive, again, I don't communicate with him, he would be 68.
Okay, do you know if there's any chronic illness running in the family?
On my father's side, I remember his father had a couple of heart attacks and then ultimately received a coronary artery bypass.
Okay.
On my mother's side, her father, my grandfather, had colon cancer. And that's it.
Do you know if they have any episode of depression or anxiety?
My mother definitely has depression and anxiety. My sister has depression, and then obviously I do too. I don't know about other family members.
Okay, now I will be asking you more about your personal past medical history. Okay, so tell me, what is your current status?
I'm sorry.
Current status? Are you married? Do you
I am
single?
partnered. I have I'm going to get married. We're in a monogamous relationship. We just haven't married yet.
Okay, and do you live with your partner?
I do.
Okay. And tell me, what is your current occupation?
I am a paramedic.
A paramedic. Okay, how would you define your stress level situation at the moment?
Very high.
Very high. Okay.
As it usually is, but higher these days since my partner wants to buy a home.
Okay, so financial status, how is it?
It could be better. You know, we've been under a lot of financial stress these last few months. Changes in employment, and then now he wants to buy a home.
Okay. And tell me, do you smoke or drink?
I occasionally, maybe once or twice a month, will have a glass of wine, but I do not smoke. No.
Okay. And tell me, are you, well, I will ask you now some intimate questions
Sure.
regarding your well, sexuality. Which
Sure.
would be, are you sexual active right now?
I am, yes.
Okay. And your partners, are they, well, they have been male, female, both?
Male.
Male. Okay. And lastly, do you practice safe sex?
I do not.
I do not. Okay. Now I would like to move on to the physical examination.
Okay.
Okay. First, I would like to assess your pulses. Would that be fine with you?
Yes, ma'am.
Okay. Could you please lend me your hand?
Sure.
I will first assess the radial pulse. Okay. I'm going to move on to the brachial one. You could please bend your arm. Release it, please. I would like to do it in the other hand. Could you please bend your hand? Okay. Once again, your arm, please. Lower it, please. Now you can lower your arm. Tell me, have you present anything about shortness of breath lately?
No.
No other symptoms related to the chest pain?
Not that I've noticed. I've not had any coughing or wheezing or shortness.
When it happened, were you sweating a lot? Were you?
Not that I can recall. It came on pretty sudden, but I don't recall sweating or anything like that.
Okay, so you haven't had any. How would you define your palpitations? You can tap the table if you would like for me to know if you have any irregular rhythm.
Yeah, I would say I've not felt palpitations or any like abnormal beats in my heart. So I guess I would say it would be irregular.
Okay. And does this chest pain, does it increase or does it relieve when you are laying down, when you are sitting up?
No, I noticed it was the same because I was trying to I'll go to sleep, but I'll wake up and I'll feel better. And even when I laid down, it maintained it was the same about 2, 3 on the scale.
Yeah. I will continue assessing your lower limb pulses. Would that be fine with you?
Yes.
Okay. First, the oblique one. I will need you to slightly bend your knees a little, okay? And you can lower it. Okay. You can lower it, please. You can lower it. Okay, I'm going to go into the posterior tibial one. The other side. Okay, and lastly, the dorsal pelvis. I would like to move on to the carotid pulse, which will be near your neck. Would it be fine if I get in close contact with you?
Sure, absolutely.
Okay. Please, I will ask you to sit straight. I'm going to locate your Adam's apple and slightly lower. And once again, on the other side. Okay. Now I would like you to lay down completely straight, please. I am going to do the physical examination part, which will be with my stethoscope. I will auscultate your heart in specific places. You can relax and breathe normally. Your heart at the moment. Okay. First, I will locate the aortic artery. Pulmonary artery. Okay, tricuspid area. in the Toronto area.